So, good afternoon, everyone. This is Murari. I'm the team lead, and we welcome you, ma'am, Supriya MK, our coordinator, project coordinator, and my fellow teammates, that is Shashank, Praneet, and Srinivas. So, I will begin our presentation on the Pharma AI, that is the title Pharma AI, which is nothing but the medical prescription validation. So, our project addresses one of the most overlooked but dangerous problems in healthcare domain. So, that is the prescription errors and fraud. So, in recent days, and it has already been happening in many places, that is, the handwritten prescriptions are often illegible and manipulated, or it may be a fake prescription, so which can lead to wrong drug administration and misuse of controlled medicines. So, our goal is to build an AI driven prescription validation system, so which actually makes prescription structured, safe, and verifiable. Okay, this is just an overview of our project. So, going to the scope and goals of our project. So, the first goal is to convert clinical input to safe, variable, and prescriptions. That is, so we'll be using speech or text recognition algorithms, which converts from speech to text, and it actually detects the conversation between a patient and the doctor, and it automatically safe and variable prescriptions will be generated. And it's not that just it's just not that, and also it converts both adult and pediatric dosing, and it also integrates region specific brands and human in the loop verification. And also outputs include a structured, that is the JSON files will be generated, and printable prescriptions, and also QR codes will be generated, which can be easily verified by sharing just the medical information rather than the patient personal details or anything else. And coming to the problem statement, so let me explain in terms of a scenario. Okay, so just imagine a busy clinic where a doctor quickly scribbles a prescription in a hurry, and the pharmacist misreads the dosage, and or someone presents a fake prescription which is not actually prescribed by a actual doctor for any restricted drugs which should be given on the approval of a doctor. So he may present a fake prescription, and he can take those restricted drugs. So both cases put patient safety at risk, which is a serious concern. And our system ensures that every prescription is validated, structured, and safe before reaching the patient. And coming to the tech stack, so we'll be using Whisper ASR for speech to text translation, and that is the NLP model with NER, and regex for extracting drug entities. And not just that, we also use RxNorm and custom mappings for normalization, and rules engine to apply dosing guidelines, allergy checks, and we'll be training our model in such a way that it can grasp those you mean symptoms by their recognizing their voice, and as well as the symptoms they cause. And and also we'll be using QR code generation, so which can be used by the pharmacist as well as the doctor, so that scanning the QR code will give the pharmacist an information about which doctor has given the prescription on which specific date. And we can also the main intention is that by adding an expiry date for the prescription. That is, for example, you have consulted a doctor today and you have obtained a prescription, so you'll be going to the pharmacist and taking the medicines today, but your next consultation for the doctor will be after 10 days. But you may take your own decisions and you'll get the medicines again instead of consulting a doctor, and you may take your own decisions, but taking those high dosage will lead to a serious risk. So the pharmacist here uses the QR. If he scans the QR, he gets to know when is the next schedule of the doctor and when was the prescription given, so that he can see the he can validate the prescription if it is expired and there is no scope of getting the drugs by the patient. So this was just the overview, and next the algorithm and the system design will be explained by Shashank. Thank you.
Thank you, Murari. Now it's me, Shashank. Now I am going to explain the algorithm and system architecture of our project. First is the algorithm. It involves 7 to 8 steps. First one, the input acquisition. It accepts the audio or text. Audio is converted to text via Whisper ASR with timestamps and confidence. Next is the entity extraction. extract drugs, dosage, frequency, duration, route, and disease using the hybrid NLP approach. Next step is the normalization. Here it maps the drugs to standardized RX norm identifiers and resolve the synonyms and to apply the fuzzy matching. Next is the custom mapping. It adapts to local brand availability, pediatric formulations, and region-specific rules. Next is the fifth step. It's the validation. Here we are going to apply the age, weight, allergy, and disease-specific dosage rules. And it also involves the pediatric dosing in milligram kg or per day, where the adult is dosing is fixed into lookup. Next, the sixth step is prescription structuring. Here, the conversion of validating data to standardized JSON with metadata, confidence scores, and adult trail is going to happen. Next, seventh step, human in the loop review. If the review is flagged, it goes to clinician for verification. Next, last step is the final output. Here we are getting the final output in the JSON or printable PDF or audit log. So this is about the algorithm steps of our project. Next is the system architecture. It involves the ASR layer, which uses a whisper module for transcription, and the next is the NLP layer. It extracts the drugs and dosage entities. Next, a normalization. It maps to the RX norm. Next, custom mapping. It adds the regional drugs to the description. Next, rules engine. Here the some of the rules are present. It validates the dosage and detects the conflicts in the project. And the review UI. Here the human verification is going to happen when required. And last is the storage. It includes Supabase and Cloudinary and immutable logs. So this is all about the algorithm and the system architecture of our project. And this is our system is structured and from input to output, ensuring the correctness and safety. Now the next methodology is going to be explained by our teammate Praneet. Now I am going to hand over to him.
Thank you, Shashank. I will now be explaining about the methodology, which focuses on how the system validates and ensures safety. Methodology consists of mainly 4 points, that is pre-processing validation, drug cross verification, AI-based anomaly detection, and NLP verification. First, the pre-processing validation does is it extracts the data and it cross-checks against trusted drug databases, which we have trained in the project, and it ensures accuracy of drug names and dosages and prevents misinterpretation. The drug cross verification works as it confirms that prescribed drugs match real and available medicines and flags fake or altered prescriptions. Next is AI-based anomaly detection. It detects abnormal patterns or possible fraud in prescriptions and ensures early detection of manipulated prescription. And next is NLP verification. NLP models validate prescription, instruction, and detection inconsistencies and ensures that dosage, frequency, and duration are aligned with medical guidelines. And the methodology ensures that every prescription that goes through our system is accurate and safe for the patient. This is about my part, and I'll be handovering to the Shrinivas. Thank you.
Thank you, Praneet. Now, I will walk you through the backend user interface and output of our system. So, our backend consists of MongoDB database and also the PDF downloading structures. And so this is just a small output of our project. Here you can see a patient dashboard, and here we have the prescription, and you can see the QR code in our prescription. Now, so our backend consists of MongoDB database, and Cloudinary handles the prescription image and media storage, and audit log system ensures immutability and traceability. Now, let me walk you through our interface now. So ma'am, this is our project front end interface. This is a patient interface, ma'am. You can see pill time scheduling, Pharma AI, and Pharma, which is a chatbot. It is not ready yet, ma'am, but we have just created a demo, ma'am. Here you can ask about the medications, like general specific any general questions. And next we have OCR scanner. Here we will be verifying the prescriptions, if it is correct or not, like that, ma'am. Next, uh, also we have doctor dashboard, ma'am. Where the doctor will be creating the prescriptions based on the doctor and patient conversations, ma'am. Next, the output of the doctor and patient conversation will be converted into text, and the text will be and from that text we will be extracting the entities, ma'am, like fever, cough, and other medical related words, ma'am. That entities will be then mapped with the drug databases, ma'am. In that drug databases we map disease to drug, ma'am. If patient says fever, then we will be checking our database with the fever and mapping with if a patient have fever, then we will be telling them that paracetamol is the correct medicine. Like I will show you a drug database that we have collected. So ma'am, you can see a drug database, ma'am. Here we have ID and symptoms and questions. Like if you ask muscle cramps and weakness, then the disease prediction is electrolyte imbalance, and recommended medicines are electrolyte solution, potassium sulfate, and the advice will be stay hydrated, maintain balanced diet. This will be the advice given to the patients automatically from the database. And also doctor will be having a manual verifications, like it is not entirely dependent upon the AI, ma'am. So doctor should also manually check the medicines if they are correct or not, and then we can proceed to the next step, which is prescription creation. After creating the prescription, there will be QR code generated, and when you go to the shop, which is pharma or any medical shop, they'll be first verifying the prescription if it is generated from a correct doctor or not. So to verify the prescription, they will be having a QR code that I have shown you. So ma'am, here you can see the QR code, ma'am. The shop dashboard. In the shop dashboard, they will be having a prescription scanner. They will scan the QR code and then they will assign the medicine, ma'am. So that's it, ma'am.
So, well, thank you, Srinivas. It was a very good explanation. So, on behalf of my team, I sincerely thank our project guide, Dr. Sanjay Pande, BM, Principal and Professor, GM Institute of Technology, Department of CSE, and for this valuable guidance. And our coordinator, Ms. Supriya MK, and our head of department, Dr. Shivanagouda G M, for their consistent support. I would also like to thank all faculty members and my peers for their encouragement and feedback. Finally, we thank the audience for their time and attention during our presentation. So, with this, we conclude our presentation on Pharma AI, that is the medical prescription validation. Thank you and have a great evening. Yeah, ma'am, we are done with the presentation.
Yeah, you have done with your presentation?
Yes, ma'am.
Yeah, ma'am, we have completed with all the presentation and we have also showed the backend working.
Yeah. I have seen that is database also, right?
Yes, ma'am.
Yeah, ma'am.
The data set you have shown, the type of description and all those things, medicines, and the QR code will be generated and everything, right?
Yes, ma'am.
Yeah, guys. If we are done with the recording, please do save that video.
Sure, done.
Okay, na? Yeah.
Yeah, ma'am.
Bye.
Thank you, ma'am. Have a nice day.
Bye. Have a nice day to you people. Bye.
Thank you.